How to get health insurance approved for Ozempic RX. Obtaining insurance approval for Ozempic, semaglutide, a medication commonly prescribed for the management of type 2 diabetes, and in some cases, for weight loss in patients with specific medical conditions, can sometimes be a complex and tedious process due to the high cost of the medication and the strict guidelines often imposed by insurance companies. However, with proper planning, detailed documentation, and persistence, you can improve your chances of getting your prescription covered. Here are the detailed steps to guide you through this process. Step 1. Consult with your healthcare provider. The first step in securing insurance approval for Ozempic is to have a thorough discussion with your healthcare provider. This conversation should be honest and comprehensive, covering your entire medical history, current condition, and future health goals. 1.1. Medical justification. Your healthcare provider needs to provide a clear and strong medical justification for prescribing Ozempic. This involves documenting your medical history, detailing why other medications were ineffective or had unacceptable side effects, and emphasizing the specific benefits of Ozempic for your condition. Ensure that the documentation includes previous medications tried and their outcomes. For example, did you already try metformin, a commonly prescribed cheaper drug for managing diabetes? If so, what is the reason for the discontinuation? Was it side effects, ineffectiveness, or both? Any adverse effects suffered from other medications such as glipizide, Jardiance, Actaz, Tradjenta, Januvia, etc. A comprehensive assessment of why Ozempic is essential for managing your health condition. 1.2. Letter of medical necessity. Ask your healthcare provider to write a detailed letter of medical necessity. This letter should articulate clearly why Ozempic is the most suitable medication for your condition. It should contain a patient-specific explanation of how Ozempic will benefit your health, any relevant lab results, diagnostic tests, or clinical evaluations that support the prescription, a comparison to other medications and why they are not suitable, possible health risks you might suffer if Ozempic is not prescribed. Step 2. Understand your insurance policy. Before you proceed further, it is crucial to have a thorough understanding of your insurance policy. This includes reviewing the formulary, which is the list of medications covered by your insurance plan. 2.1. Review the formulary. Check whether Ozempic is listed on your insurance formulary. If it is, look for any specific notes or requirements detailed in the formulary. 2. Insurance requirements. Each insurance company may have different requirements for covering a medication like Ozempic. Common requirements may include prior authorization. Approval from the insurance company is required before the medication can be covered. Step therapy. This means you must show proof that you have first tried and failed on one or more lower-cost medications for at least 6 months before Ozempic will be approved. Health metrics. Meeting certain health indicators such as specific HbA1c levels of at least 6.5 or body mass index of at least 30 to qualify for coverage. Step 3. Complete prior authorization. If your insurance plan requires prior authorization for Ozempic, you will need to work closely with your healthcare provider to navigate this process. 3.1. Gather necessary documentation. Ensure that all relevant medical records, lab results, and the letter of medical necessity are ready. This documentation will form the foundation of your prior authorization request. 3.2. Submit the prior authorization request. Your healthcare provider will typically handle the submission of the prior authorization request, but this process can be initiated by your pharmacist once the medication is prescribed. Be sure they have all the required forms and information needed by your insurance company. The submission should include detailed medical history, documentation of previous treatments and their outcomes, the letter of medical necessity, any other supporting documents requested by the insurance company. 3.3. Follow up regularly. Regular follow-up is essential to ensure that the prior authorization request does not fall through the cracks. Contact your healthcare provider's office to ensure the request has been submitted. Follow up with the insurance company to check on the status of your physician's request. Be proactive in providing any additional information or documentation if requested. Step 4. Appeal a denied claim. If your initial request for prior authorization is denied, it is not the end of the road. Many insurance claims are approved on appeal, so it's crucial to understand the reason for denial and address it thoroughly. 4.1 Understand the reason for denial. Contact your insurance company to obtain a clear explanation of why the claim was denied. Typical reasons might include insufficient documentation, failure to meet specific criteria, or the requirement to try alternative treatments first. 4.2 Prepare for the appeal. Work with your healthcare provider to create a comprehensive appeal letter. This letter should address the specific reason for the denial, provide additional medical evidence or documentation that supports the necessity of Ozempic, include testimonials or case studies that demonstrate positive outcomes with Ozempic if necessary. 4.3 Submit the appeal. Submit your appeal along with all supporting documentation to your insurance company. Ensure you keep copies of all submitted materials and track the submission process carefully. 4.4 Continuous follow-up. Follow up with your insurance company regularly to check the status of your appeal. Be prepared to respond quickly to any requests for additional information. Step 5. Seek manufacturer assistance. If insurance approval becomes too challenging or if you're facing significant out-of-pocket costs, explore assistance programs offered by the manufacturer of Ozempic, Novo Nordisk. 5.1 Patient Assistance Programs. Novo Nordisk often provides patient assistance programs that can significantly reduce the cost of Ozempic for eligible patients. This might include income-based assistance, copay savings cards, discounted medications for uninsured or underinsured patients. 5.2 How to apply. Visit the official Novo Nordisk website or contact their customer service for detailed information on available programs and how to apply. Be prepared to provide financial information and other required documentation. Step 6. Consider alternatives. If obtaining insurance approval for Ozempic proves to be insurmountable, discuss with your healthcare provider the possibility of alternative medications that might be more affordable. 6.1 Alternative medications. Compounded semaglutide can be obtained from a compounding pharmacy for a fraction of the cost of brand-name medications like Ozempic. This requires a prescription from the provider. There are other medications for type 2 diabetes that your insurance may cover more easily. These could include different classes of drugs like metformin, SGLT2 inhibitors such as Jardiance, DPP4 inhibitors such as Januvia, Onglyza, or Tradjenta, other GLP-1 receptor agonists such as TRUICITY, VICTOZA. Discuss the pros and cons of each alternative with your healthcare provider to find the best substitute for your condition. Step 7. Maintain detailed documentation and communication. Throughout this entire process, maintaining detailed records and consistent communication is paramount. 7.1 Documentation. Keep copies of all documents including medical records, prior authorization requests, denial notices, appeal letters, correspondence with your healthcare provider and insurance company. 7.2 Communication logs. Maintain a log of all phone calls and conversations with names of the representatives, dates and times of calls, details of discussions. Securing insurance approval for a prescription medication like Ozempic can be a complex and multifaceted process, but with thorough preparation, detailed documentation, and persistent follow-up, it is possible to improve your chances significantly. Enlist the help of your healthcare provider and make use of all available resources, including patient assistance programs offered by the medication's manufacturer. Remember, persistence and organization are your best tools in navigating the insurance approval process. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more tips on managing your health and navigating insurance approvals.